Today we're going to talk about degenerative disc disease, one of the most common causes of chronic low back pain and missed work in adults. Let's start with a big picture view. Low back pain is the second most common neurologic complaint in the United States. About 1 in 4 adults reports recent back pain, and it's not just an inconvenience. It's associated with things like depression, anxiety, smoking, alcohol use, obesity, and stress. It affects daily life, productivity at work, and comes with real economic consequences for patients and families. Now, when we talk about duration, pain that lasts less than 3 months is considered acute. But if it lingers for 3 months or more, it becomes chronic. The good news? About 90% of people with low back pain recover within 4 to 6 weeks on their own. So what's going on in the spine? Let's walk through the pathophysiology. Between each vertebra in the spine is a disc, a cartilaginous cushion that helps absorb shock and maintain flexibility. The disc has 2 main parts: a tough outer ring called the annulus fibrosus and a soft gel-like center called the nucleus pulposus. Over time, these discs can degenerate. They dry out, lose flexibility, and may develop cracks. With degeneration, the nucleus pulposus can push through the annulus fibrosus. This is called a herniated disc or ruptured disc, and it can press on nearby nerves or even the spinal cord. The pressure from a herniated disc can cause something called radiculopathy, which is pain, numbness, or tingling that radiates along the path of the nerve. If this pressure continues, it can cause changes in sensation, weakness, or even loss of reflexes. What causes this degeneration or rupture? It's often age-related, but repetitive trauma like heavy lifting or falls can contribute. Interestingly, many people don't feel the effects until months or even years after the initial injury. Now, let's talk about how this presents. What symptoms do we see? A herniated disc can occur in the cervical, thoracic, or lumbar regions of the spine, but thoracic herniations are rare. Symptoms depend on the location and how fast it develops. Common complaints include pain, limited mobility, and difficulty with activities of daily living. It can also interfere with sleep. In older adults, back pain is especially common. While degenerative disc disease is more prevalent with age, being over 70 doesn't automatically rule out surgery. A study comparing surgical outcomes in younger and older adults found similar complication rates, except for urinary tract infections, which were more common in the older group. Older adults were also more likely to go to rehab or skilled nursing afterward. So how do we diagnose it? It starts with a thorough health history and physical exam, because we need to rule out other serious causes like tumors, infections, or fractures. MRI is the gold standard for imaging herniated discs, especially in the lumbar spine. If symptoms and MRI findings don't match, additional tests like CT or myelography may be needed. We also perform a neurologic exam to assess reflexes, sensation, and motor strength, which gives us a baseline. Sometimes electromyography, EMG, helps localize the affected nerve. What about treatment? In most cases, we start with conservative management, medications, physical therapy, and exercises. Pain relief and restoring function are the goals. Surgery is reserved for patients who don't improve or who show signs of worsening nerve damage. Now let's review surgical options. If the herniated disc is causing serious symptoms like muscle weakness, numbness, or loss of bladder and bowel control, and conservative treatment hasn't helped, surgery may be necessary. The goal is to relieve pressure on the nerve and improve function. Here are the common procedures. Microdiscectomy, removal of the herniated disc fragments. Laminectomy, removal of a section of bone to access the spinal canal and relieve compression. Hemilaminectomy, removal of part of the lamina and part of the vertebral arch. Laminotomy, creating a hole in the lamina to relieve pressure. Discectomy with fusion, removing the disc and fusing the vertebrae using a bone graft to stabilize the spine. Foraminotomy, enlarging the opening where the nerve exits to reduce pressure. These procedures can now be done using microsurgical techniques, which are less invasive, cause less trauma, and preserve more normal tissue. In many cases, spinal cord function is monitored during surgery using electrophysiology to ensure safety. So to wrap up, degenerative disc disease is common, especially as we age. Most people recover without surgery, but when conservative treatment fails, or when nerve function is at risk, there are effective surgical options. As always, knowing how to assess, educate, and guide patients through these decisions is a key part of your nursing role.